Hi everyone, my name is Claire. I am the Operations Manager for Cancer working here at Cambridge University Hospitals. I would like to welcome you to this film, which will aim to explain the purpose and need of a multidisciplinary team approach and discussion for patients suspected of cancer. Finding out you have symptoms that may require further investigation can be very daunting and might make you feel scared or worried about what's going to happen next. You will be placed on what healthcare professionals call a pathway, which is designed to get you the right care as quickly as possible. This doesn't automatically mean you have a serious condition. It ensures that you are monitored closely and moved through the system to give you peace of mind, or if necessary, to begin treatment promptly. During the film, you may hear the term MDT, which stands for Multidisciplinary Team. MDT is a group of health and care staff who are members of different organisations and professions. They meet and work together to make recommendations for the responsible clinician to discuss with the patient. Support is available for you and your family at every step. Our teams are highly trained and specialised, and you are in safe hands here at CUH. No decision will be made about your care and treatment without you.
If you present yourself at your GP surgery with symptoms suggestive of a serious condition or health issue indicative of cancer, your GP may refer you for further specialist investigations. This is called an urgent suspected cancer referral. This pathway is designed to fast-track your appointment with a specialist to ensure you receive a diagnosis as early as possible. Or you may have been invited to take part in one of the national screening programs for breast, cervical, or bowel cancer. If your results indicate a suspicion of cancer, you will again have been fast-tracked for further investigation to confirm or exclude cancer. You can also be referred for investigations by other specialties or departments within the hospital, or referred by your local hospital for a second opinion, specialist advice, or for specialist treatment that is not necessarily available in your local hospital. Equally, a clinician can upgrade you onto a cancer pathway if you haven't been referred through one of these routes, and if they are concerned your symptoms may be serious. After your referral has been received at CUH, the specialist team may see you in clinic or may refer you for investigations before seeing you. These investigations may include blood tests, imaging like X-rays or scans, or biopsy. The results will be used to identify if the symptoms are an abnormality and if this is in fact cancerous, and to inform the specialist team of your condition. This will also help the MDT discussion to consider the best way of treating your cancer type and to determine next steps in your care. Although there is no set of standard investigations for patients suspected of cancer, each specialty may request different types of investigations, depending on the location of the abnormality and the body part affected. There are national best practice pathways that detail which tests could be carried out and how quickly to diagnose most forms of cancer. Once the results are available, these are collated together by one of our NDT coordinators, whose role is to ensure essential information is available for the NDT discussion.
The MDT meeting will consist of healthcare experts, including physicians, surgeons, oncologists, radiologists, histopathologists, and clinical nurse specialists known as a CNS, who specialize in specific cancer types. Other professionals like physiotherapists, dietitians, or occupational therapists may also be involved in the MDT discussion to address various aspects of any care required. Each MDT member has a different role to play, providing diagnostic, surgical, medical, practical, or emotional input. The MDT coordinator's role at the MDT meeting is to facilitate and coordinate patient referrals through the MDT and to support the MDT chair, who is responsible for the management and running of the MDT. At the MDT meeting, the histopathologist, who is a doctor specializing in analyzing biopsy samples to determine your exact tissue diagnosis, will discuss these results if you've had one completed. And the radiologist will bring up any scans such as X-rays, CT scans, or MRI to present any abnormal findings. This will initiate a discussion within all members to consider different treatment options available and to formulate appropriate recommendations. Your case will also be discussed at an MDT meeting at each appropriate stage of your treatment plan and may be rediscussed if there are any changes in your diagnosis or progression. The MDT may also suggest any further tests that need to be carried out, making appropriate referrals to specialist services or which clinical trials might be suitable for consideration. The MDT recommendations will be agreed and finalized at the meeting, and the clinical team will document these in our patient record system called EPIC. Often, local hospitals refer patients to a specialist MDT discussion at CUH. If this is the case, the local team will dive into the MDT meeting and summarize your results. CUH is a tertiary center, meaning that regional patient cases can come to us to receive appropriate treatment, which may not necessarily be available in their local hospitals. Patients are not permitted to attend the MDT meeting, partly due to the number of patients discussed and patient confidentiality. However, the CNS, either from CUH or from other hospitals, who may have been previously met the patient, will act as the patient's voice at the MDT. Where possible, they will ensure your views and wishes are highlighted and considered. The frequency of MDT meetings varies depending on cancer type. After an MDT meeting, you will have an opportunity to discuss the outcome with a member of the specialist team. This will often be the CNS or the specialist clinician, either at CUH or your local hospital, who will discuss your MDT outcome and recommendations in a face-to-face outpatient appointment, via a video appointment, or telephone. You can then decide which option is the most suitable for you. You will then be contacted by a member of our admin team to schedule any appointments. This is likely to be via a phone call, and so please be aware CUH calls will be anonymized and therefore the call will be from an unknown ID. So please ensure you keep your contact details up to date. If having a face-to-face outpatient appointment is your preferred option, you will most likely need to attend one of our outpatient clinics. For more information about attending the CUH campus, please see our cancer services pages of the CUH websites, where you will also find helpful information and a welcome video. Once you have arrived at the hospital for your clinic appointment, you can check in at the reception desk or via the MyChart. After confirming all necessary details, you should remain in the waiting area. This is where a member of the clinical or the support team will call you in and take you to one of our clinic rooms for your consultation. You can be accompanied by a family member or friend if you wish, who will be able to provide support and help you with writing down information and assisting with any questions you may have. You may find it useful to jot down questions beforehand to help you remember anything important you wish to ask. Sometimes you may have already been admitted to one of our wards at CUH when you're told the results of your tests and MDT outcome. You will still have the opportunity to discuss treatment options with a specialist clinician.
At the start of your appointment, You will be greeted by the consultant and your CNS, who will introduce themselves to you. They will then proceed with discussing the recommendations reached by the MDT. The consultant and your CNS will make every effort to clarify any information and discuss matters important to you. This is to ensure you can make an informed decision about your treatment and care. You will be encouraged to write down any essential information. However, the details and a contact telephone number for your CNS will be provided to you at your clinic appointment. You can contact them should you have any worries or need further information after your appointment. You may need to leave a message, but they or another member of team will get back to you as soon as possible. You may also be able to contact your clinical team via my chat messaging if this function is available within the clinical specialty caring for you. The team will respond to you within 10 working days. If there are multiple treatment options available, you may be given some time to consider what is best for you. Your CNS will contact you to further discuss your options if necessary, or will liaise with the booking team, who will contact you to arrange a follow-up appointment to finalize your decision and next steps. At your clinic appointment, you may also be given a consent form to sign to avoid any delays with starting your treatment. Sometimes it may be necessary to send you for further scans or investigation on the day. Often at the end of your appointment, you will be provided with a cancer patient information pack which contains practical information such as parking, wayfinding, and services available on the CUH campus. You may also be assigned a cancer navigator who will contact you to offer you support and access to services that may be important to you at different stages of your care. All decisions and detailed summary of your clinic appointment will be recorded in our patient record system, and a summary of your treatment plan will be shared with you and your GP, who will be kept informed about your treatment and care.
Thank you for watching. We hope this film has helped you to understand some of the most important information about the MDTs and your possible pathways. If you have any further questions, please contact your CNS on the telephone number provided to you at your consultation. If you, however, have any non-clinical questions or concerns, you can contact your cancer navigator, the support advisors, or visit the Cancer Support Service Information Pod, located in Oncology Outpatients on Level 2. Additionally, if you would like more information about cancer services at CUH, please visit the CUH website.